This lecture is Life Stage Feeding 2, Feeding the Growing. The goals of this lecture are to review the nutrient requirements of growing foals, to provide guidelines for feeding the healthy orphan foal, and finally to discuss the dietary management that can be used to reduce the risk of developmental orthopedic disease in young growing foals. We'll begin with the nutrient requirements of the neonatal foal, beginning with water. Foals have a higher water requirement than adult horses because they have a higher percent of their body as water. A general guideline is that foals require 80 to 120 mils per kg per day. Depending on the age of the foal, they may consume an additional volume of milk and water, somewhere between 225 to 182 mils of fluid per kilogram of body weight from 11 to 39 days of age. Anytime you have a neonatal foal or a young foal that's in the hospital receiving either IV fluids or a combination of IV and enteral fluids, you need to monitor those foals very closely for overhydration. Healthy foals often consume enough milk that they do not drink much water. The energy requirements of the foal are based on the intake of mare's milk. And a healthy foal will consume 120 kilocalories per kilogram of body weight per day during the first week of life. As an example, a 50 kilogram foal consuming 120 kilocalories per kilogram of body weight per day would consume 6,000 kilocalories per day. Mare's milk contains 480 kilocalories per liter. So how much does this 50 kilogram foal need to consume to meet its energy requirements? Taking the 6,000 kilocalories per day and dividing that by the amount of calories in a liter of milk, you'd find out that that foal requires 12.5 liters of milk per day to meet their energy requirements. The next question would be, can a 50 kilogram foal drink this much? Doing a little bit more math, we find out that 12.5 liters is about 25% of the foal's body weight per day in milk. Foals can drink that much. That's about the top level on a percent body weight basis that you would expect a healthy foal to be able to consume. The energy requirements for foals that are critically ill are lower than they are for healthy foals. Based on research that's used indirect calorimetry to determine nutrient or energy requirements, critically ill foals require somewhere between 40 to 50 kilocalories per kilogram of body weight per day. And so that 50 kilogram foal, now critically ill, would only require 2,500 kilocalories per day instead of 6,000. It's very important that when you're dealing with a foal that's hospitalized that you don't provide excess calories, because hyperalimentation can be a problem in your hospitalized foals. Older foals in a critical care setting can be fed somewhere between 70 to 100 kilocalories per kilogram of body weight per day. Moving on to protein now, the requirements of a neonatal foal are based on the intake of mare's milk. 6.8 grams of protein per kilogram of body weight are required during the first 2 weeks of life. Foals that are consuming commercial equine milk replacers will be able to meet their protein requirements when they consume digestible sources of protein, usually animal-based protein. And the milk replacers, the commercial milk replacers, are formulated to match the protein concentration in mare's milk. Usually they have somewhere between 21 to 24% protein. If you're looking for a substitution for an equine-specific milk replacer, oftentimes cow's milk in an emergency can be used, but whole cow's milk contains 31% protein, which is much too high. Goat's milk is a little bit closer to the protein content of mare's milk at 27% protein, and neither of these are ideal substitutions for either mare's milk or an equine-specific milk replacer, but we'll discuss a few more details about that a little bit later in the lecture. Critically ill foals that are being treated with a parenteral nutrition solution usually require a lower concentration of protein, and that range is somewhere between 2 to 5 grams of protein per kilogram of body weight per day. The next nutrient is lipid, and neonatal foals require 4.5 grams of lipid per kilogram of body weight during the first 2 weeks of life. Commercial equine milk replacers are formulated to match the fat concentration in mare's milk and have somewhere between 1.4 to 1.8% fat. Whole cow's milk not only has too high of a concentration of protein, but it's too high in fat as well at 3.5%. Low-fat cow's milk is closer to mare's milk and will be a better option if an emergency milk replacer is needed. This will be discussed a little bit later in the lecture. Critically ill foals on a parenteral nutrition solution require a lower concentration of fat, somewhere between 1 to 3 grams of lipid per kilogram of body weight, but some critically ill neonatal foals will have hypertriglyceridemia. So before you ever add lipid to a parenteral nutrition formulation, you always need to make sure that the triglycerides are checked in the serum and that the foal doesn't have any complications with hypertriglyceridemia. Vitamins and minerals have not been researched in foals to a great extent, and so the information that we have about what the requirements are again based on the vitamin and mineral profile in mare's milk. Commercial milk replacers have been formulated to match the content of vitamins and minerals in mare's milk, and so if a foal is consuming a commercial milk replacer designed for foals, then they should be meeting their requirements. If you have a critically ill foal, again, and you're using a parenteral nutrition formulation, you can add vitamins and minerals if you expect that the parenteral nutrition will be administered for greater than 3 to 5 days. Neonatal foals require colostrum. That's the first milk that the foal will consume after they're born. It has a high concentration of IgG as well as the other immunoglobulins IgA and IgM, and it's required for the passive transfer of immunity for the neonatal foal. The immunoglobulins are absorbed through penocytosis within the intestinal tract during the first 24 hours of life. After that time, penocytosis is no longer an active process, and the large immunoglobulins cannot be absorbed across the intestinal lumen. Foals ideally should stand a nurse within 2 hours after they're born. Foals that are unable to consume colostrum for any variety of reasons are at risk of failure of passive transfer, or FPT, and that can be a very serious complication in neonatal foals. And if a foal does not receive the immunoglobulins from the mare or from supplemental, either enterally administered immunoglobulins or from IV plasma, then they are at a high risk of dying. Any foal that does not consume colostrum within the first 6 hours of birth should be administered colostrum enterally. A nasogastric tube is placed, and then the foal is administered 1 to 3 liters of high-quality colostrum over 4 to 6 hours. Ideally, the dose that you will want to try to achieve is 1.5 grams of IgG per kilogram of body weight. IV plasma will be necessary if the foal is older than 24 hours and they still require immunoglobulins. Part of the normal neonatal exam of a foal will be to measure IgG in the serum with a stall side test, and depending on the concentration that you find when you're examining the foal and doing your serum testing, you will either decide to administer additional colostrum or possibly plasma, or if the foal has an adequate amount, then that kind of therapy will not be required. The next slide discusses some recommendations for the healthy young foal as far as feeding from birth to 3 months. Mare's milk will provide essential nutrients in the early months of a foal's life, and it's important to monitor the foal when it nurses. 5 to 6 times per hour is normal for a healthy foal. You want to often check how often the foal is nursing from the mare. If the foal continues to look for food after what appears to be an appropriate time of nursing, make sure that the mare is actually producing adequate milk for the foal. It's important to monitor weight gain and body condition score the best that you can in growing foals. If the foal is not growing well due to inadequate milk intake, you need to supplement the diet with a milk replacer. On the other hand, if the foal is growing too quickly, they'll be at risk of developing orthopedic problems, and those foals that are growing too quickly may need to be weaned early, and sometimes as early as 2 months of age. A general guideline is to provide the foal with a creep feed at 1 month of age. And it's always a good idea to discuss an appropriate weaning age with the client so you and the client can make a plan for how that foal will be transitioned from a milk-based ration to an older weaned foal ration. Healthy older foals of 4 to 6 months of age are usually consuming high-quality forage. If they've been weaned, they should be consuming adequate protein in their ration. You will want to try and find forage that has somewhere between 13 to 17% protein. You want to make sure there's adequate lysine and threonine in the diet. These are the first 2 limiting amino acids for growing foals. And if the client is feeding a high-quality alfalfa hay, you want to make sure that the diet has a proper balance of calcium and phosphorus, and that adequate phosphorus is included in that ration because calcium usually is very high in alfalfa hay. Monitoring body weight and body condition score is important in older foals of 4 to 6 months of age, and many weight tapes are actually validated down to about 3 months of age in foals, and so an owner can use a weight tape and also take sequential pictures of the foal to monitor body condition score, and they can communicate with you to determine if the foal is growing too quickly or isn't growing quickly enough. It's a good idea for owners to keep a growth journal for their foals. They can actually plot the estimated weight of the foal based on the weight tape along a growth curve that's made from the NRC guidelines for average weight of foals at every single month of growing age. And you can make a growth chart for clients and then have them plot that data on the chart. And if the foal either gains too much or falls off from the chart and isn't gaining enough, then you can discuss appropriate feeding changes for that foal's nutrition program with the client. I mentioned again that earlier that you may need to wean the foal early if they're growing too quickly, and discussing an appropriate weaning age if your foal of 4 to 6 months of age hasn't been weaned yet is important. Offering a creep feed was mentioned for foals as young as 1 month of age. A creep feed is a concentrate like a grain or a commercial foal feed that's placed into a feeder, often called a creep feeder, that only the foal can access. This grain-based type of feed is going to be necessary to provide adequate energy and nutrients as the foal ages. Grain is going to be digested better than forage, and as the foal gets older, mare's milk won't be able to meet all of the energy and nutrient requirements of that older growing foal. And so supplementing the milk-based ration with a creep feed will be important. I'm fairly conservative in my recommendations for creep feed. My recommendations are up to 1/2 pound per day per month of age, so at 2 months of age, a foal would consume 1 pound of creep feed per day. Anytime a foal is being offered a creep feed, you want to monitor the energy intake of that foal to ensure the supplemental feed is not providing too rapid growth. In some cases, the foal will not only consume the creep feed that they're being offered, but if the mare is being offered a supplemental feed, the foal might get into the mare's feed as well. And that excess energy intake can lead to orthopedic problems if not caught and stopped early on. A few commercial feeds that would be appropriate for use as creep feeds are listed here. This is not an exclusive list. Almost every commercial feed company that produces equine feeds do have appropriate growth feeds for foals, but Strategy Professional Growth, Ultium Growth, and Equine Junior All Purina Mills feeds would be appropriate. And then another company, Triple Crown, has a growth feed as well. Note that coprophagy is normal in young foals. That's how they help to populate their gastrointestinal tract with bacteria. And so if you see a foal nibbling on the mare's manure, that's very normal, and it's a healthy process that needs to occur. Weaning the healthy foal will vary, oftentimes based on the client's use of the foal and their preference. Oftentimes the time frame is somewhere between 3 to 6 months of age. If the foal is growing too quickly from consuming mare's milk, then they should be weaned earlier than that. Weaning is a stressful period for both foals and mares, and there have been some studies done that have shown that the more stress that the foal encounters during the weaning period, the higher their cortisol concentration, and the elevated cortisol can adversely affect nutrient intake of those foals. Research has also shown that foals that are provided a creep feed have less stress during weaning, and they have a better transition to a ration that does not include mare's milk. So that would be another really good reason, not only to provide additional nutrients in a creep feed, but also to help the foal transition to a weaned ration as it gets older. Finally, another study looked at gradual weaning protocols, which were done across a fence line where the foal could still see the mare. And they found that even though the foal was separated from the mare, if they could see each other through a fence line, the foal had less stress and lower cortisol compared to when foals were pulled away from the mare completely with a sudden weaning process. The foals that were gradually weaned had increased curiosity, and they showed less fear and reactivity than the foals that were weaned suddenly in the study. And the beneficial effects of this gradual weaning in the young foals were noted for at least 3 months of age with the lower cortisol. Foals continue to grow well into their second year of life, and oftentimes will continue even further on in age. It's estimated for a standard size horse that they will achieve 65% of their adult body weight at 12 months of age and 78% of their adult body weight at 18 months of age. Once a foal reaches 12 to 24 months of age, their ration will be similar to an adult horse ration, mainly comprised of forage and concentrates, which are grains or a commercial feed that's appropriate for growth. The goal with these older horses is to provide nutrients that are consistent for growth. And if you're dealing with an equine athlete, maybe a racing thoroughbred that is not only competing and needs energy for work, but is also growing, you have to make sure that all of their nutrient requirements are met. And the NRC is a very good guideline for specific nutrient requirements based on age and level of work, and will provide guidelines with the online program for up to 26 months of age. In the next section of this lecture, we'll discuss how to appropriately feed the orphan foal. First, we'll discuss what to feed. It can be a challenge to try and figure out what to feed to an orphan foal. A nurse mare is going to be your best option if one is available. A nurse mare is usually a mare that has lost her own foal but is still producing milk. You may also have a mare that is producing so much milk, like a draft mare, that she can actually produce enough milk to support 2 foals. Nurse mares used to be very hard to come by, but in this new technological age, it's very common for veterinarians to post about a mare that's lost her foal and that is available as a nurse mare, or for veterinarians to post about an orphan foal that needs a mare. And so oftentimes foals and mares can be matched fairly easily within a regional area. If mare's milk isn't available from a nurse mare, then a commercial equine milk replacer will be the next best option. And milk replacers that are designed for foals closely match the nutrient composition of mare's milk, and all the products that you can find commercially available that are designed for foals are good quality, and so that would be another good option. Next down the list becomes goat's milk. Some foals will develop constipation if they're consuming pure goat's milk diet. Sometimes you can combine goat's milk with a commercial milk replacer, but goat's milk is further away from the composition of mare's milk and is not something that is ideal to use if you have a commercial equine milk replacer available. Last on the list would be cow's milk. This is more of an emergency solution. For example, if you have a foal that was born early, maybe Christmas Eve, everything's closed, feed store's closed, not going to be open for a couple days, and the only place that's open is the mini mart down the road. Low-fat cow's milk, the 2% cow's milk, can be used as an emergency milk replacer. Again, you want low-fat cow's milk. You don't want whole milk. You don't want no-fat milk. So the 2% cow's milk, you want to add 20 grams of dextrose per liter of milk in order to try and more closely match the carbohydrate concentration in mare's milk. You do not want to add sucrose, which is table sugar, honey, or corn syrup, because foals do not have the enzymes designed to break down those sugars, and you'll instead give the foal an osmotic diarrhea. The big thing to remember about cow's milk is it is a very short-term solution, and you'll want to try and transition the foal to a more appropriate milk substitution as quick as possible. Foals can become orphans for a whole variety of reasons. I placed this picture in the slideshow just to show one fairly uncommon reason that a foal can become an orphan. This mare presented with the foal, so the foal could be monitored, and as the mare was being milked, unfortunately, some bacteria was likely introduced into the teat, and she developed a very severe toxic mastitis. The mare, her temperature went into the 106 range. We were quite worried that we might have trouble with her and her own safety and health, and so the foal was weaned. The mare was dried off. Fortunately, she recovered, but then she had a foal that needed to be raised off from the mare, and so that was done using a milk replacer. Once you decide on what you're going to feed, you need to decide how much you're going to feed to the neonatal foal. Foals up to 2 weeks of age, you can use the neonatal foal guidelines that were provided at the beginning of the slideshow, or you can feed as a percentage of body weight. And feeding by percent of body weight is fairly simple and is a relatively easy way to provide the foal with adequate nutrition. Foals older than 2 weeks of age, some general guidelines are on day 1 to feed to meet 10% of the foal's body weight. By day 2, you can increase the volume to 15% of body weight if the foal has tolerated the 10%. And finally, by day 3, you can increase the volume to 20% of the foal's weight. You might think that with a healthy foal you can start out with a high volume, but remember, even if you have a healthy foal, you are still transitioning them from what they were drinking from the mare and then transitioning them onto a commercial product. So it isn't exactly the same. And if a foal has been orphaned without delay period, let's say the mare was euthanized because she had a colon torsion, that foal is going to be very stressed. And so providing a smaller volume of milk to make sure that the foal is tolerating the milk and that they are remaining healthy is a smart way to go. With a neonatal foal, in a NICU situation, me as a clinician, I would always start even a lower volume, because sometimes you don't know with a sick foal if they have intestinal ileus and you don't want to overfeed. And so in my opinion, it's always reasonable to start very slowly, even for a day or two. If you have a neonatal foal in the NICU, you can always give them some dextrose for some extra calories. But for a healthy foal, feeding them at 10% of their body weight should maintain their weight. They're not going to gain at that volume. But for a day or two, it's a reasonable volume to start at, and then you gradually increase the volume. When you're working with a neonatal foal or a younger orphan foal, you always want to monitor basic health parameters like weight gain, hydration status, and their clinical condition to ensure that they're tolerating the new feeding plan. What is the method to feed an orphan foal? I'm going to start at the bottom and talk about bottle feeding. Bottle feeding is a decent short-term option, and if you have a foal that's been nursing a mare and is used to suckling from a teat, then transitioning them from the mare to a milk replacer using a bottle is a very logical way to go. The foal should be able to nurse from the bottle as long as they have a strong suckle, and that is useful in the early stages of the period when the foal has been orphaned. But again, it's a short-term option. One problem that can happen with bottle feeding, especially if you don't check to see that the nipple doesn't leak milk, is that you put the whole foal's neck outstretched and more towards the ceiling or the sky. Then if the foal doesn't have a good suckle and it doesn't have a good swallow reflex, that foal might end up aspirating some of the milk. And so if I'm ever feeding a foal using a bottle, I'll try and drop the foal's nose fairly close I'll drop it to, not to ground level, but I'll lower the bottle quite a ways so that I will make sure that the foal has a really good suckle and that they can swallow, and it'll lower the risk of aspiration. One of the big problems with long-term bottle feeding are behavioral consequences. Novice horse owners especially will want to bond with orphan foals, and oftentimes they will do that through feeding them by a bottle. But if that's done for a long period of time, over weeks and months, the foal will eventually associate the human feeder with another equine, and they will start to act in a way that is inappropriate and that can actually be dangerous to any human that ends up handling them. Pinning their ears, biting, kicking, striking, treating the human as they would another horse can be very dangerous, especially as that foal gets to be 500, 600, 700 pounds. And so my recommendation for orphan foals is, once they're stable, they're consuming milk, and you know that they're healthy, is to try and transition them to a bucket or pan as soon as possible. Feeding from a bucket or pan will decrease the risk of aspiration. The suckle response must be present and strong before the foal can actually get the milk to the back of their oral pharyngeal area and then swallow it. It's definitely better from a behavior standpoint because the owner can just put the milk in a pan, walk away, and so the foal doesn't have that direct connection with bottle feeding and whoever's feeding the foal. And then it also becomes easier from a dietary management standpoint. As the foal ages, a lot of commercial milk replacer companies have milk replacer pellets, and with time the owner will get tired of mixing the milk replacer with water and preparing it. And so if you can transition a foal to a pelleted milk replacer diet, it can be much easier from a management situation as well. At the very bottom of the slide in the royal blue colored font is a note of never syringe feed a foal. This is very important. When you're dealing with a client, especially a novice horse owner, and oftentimes before the foal is born, let the client know that if the foal is born and doesn't stand a nurse within 2 hours, they need to call you out, even if it's in the middle of the night or the weekend, in order to evaluate the foal and administer colostrum properly if necessary. A lot of clients don't want to make an emergency call, they don't want to pay an emergency fee, but they might know that colostrum is really important. And so if a foal is born and isn't standing and nursing for whatever reason, maybe the foal has a strong suckle but has some contractures in its limbs so it can't stand. I've seen clients go ahead and go into their kitchen, get a pan, they'll milk the mare, get the colostrum, and then they'll get their turkey baster and start to syringe feed the foal. In every case that I have managed like that, the foal has gotten an aspiration pneumonia and hasn't survived. So talk to the client. You don't want to scare people away from feeding a foal, but they need to understand that there are certain protocols that need to be followed in order to keep a foal healthy. And especially as far as colostrum is concerned, if a foal can't nurse for whatever reason, they need to be treated. Even with an older foal that's maybe gotten sick, if they're not standing and nursing, they need medical care, usually with a nasogastric tube, and to either be fed enterally or to get IV nutrition or dextrose. This photo shows the feeding of a foal with a bottle. This was a miniature foal that was an orphan, and you can see the foal's head is fairly perpendicular to the ground. Ideally, the muzzle would be a little bit lower to the ground, but this is much better than extending the neck. And there are a couple different ways that you can try and entice a foal to drink from a pan. Sometimes it can take days or even weeks for a foal to understand how to quite make it happen. Don't ever skip a feeding trying to make the foal really hungry so that it will learn. That doesn't work. They'll learn on their own timeline. So you can try to offer a pan for maybe 5 minutes before you offer a bottle, but don't ever skip a feeding because that will not be healthy for the foal. It will cause more frustration, but it's fair game to offer a pan early on, and if they don't drink and don't take interest in it within a few minutes, and just go ahead and feed them normally. This first photo, it's hard to see, but the nipple and the top of the bottle are actually being dipped into the milk almost like a straw, and so the foal is suckling on the tip of the nipple, and then in some cases they'll be able to get enough milk into their mouth that they will realize that they're actually able to drink from a pan. Another way to do this, and you need to have very, very clean hands or wear a glove, is to have the foal start to suckle on your finger, and then you can gradually just dip your finger below the level of milk in the pan, and then as the foal is suckling on your finger, they'll be also getting milk into their mouth. And once a foal understands how to nurse or drink from a pan or bucket, they get it, but it can take a long time. So patience is really important with this. And if you ever send a foal home with a client and it's still on a bottle, especially if it's a novice horse owner, it's really good to continue to work with the client to make sure that the transition program is going well. It may be even worthwhile sending them home with a video, but frequent phone calls and making sure that nobody's getting too frustrated with the process can be important. How often do you want to feed an orphan foal? When they're very young, every hour, usually during the first 48 hours of life, but you can extend that to every 2 hours for the first 2 to 4 weeks of life, and then gradually increase the time of feeding as the foal ages. What you want to make sure is that you're not providing too much milk into the stomach at each feeding in a very young foal. Remember, horses can't vomit, and so if you overfeed a foal when they're very young and don't have the stomach capacity to handle a larger volume of milk, then you're going to get a colicky foal, and that can be a real problem. So I am, again, fairly conservative every 2 hours for the first 2 to 4 weeks of life, and as the foal gets older, every 6 to 8 hours once the foal is somewhere between 2 to 3 months of age, or 8 to 12 weeks. Providing free choice water to an orphan foal is important, but you want to monitor the foal to make sure they're not drinking excess amount of water. They can develop hyponatremia if the water intake is excessive. A couple other options, if you have a mare that is producing milk but the foal isn't drinking from her, you can try and obtain milk in a few different ways. The biggest thing you want to do is try and prevent mastitis, like the photo I showed you. Clean hands, ideally wearing gloves. The teat size in mares makes the introduction of bacteria within the teat a little bit more likely than with cows. The two pictures here are showing a contraption called the Utterly Easy Mare Milker. The top photo has a handheld vacuum pump, and it just fits around the mare's teat, and you depress handle, and then a suction is created, and then you get milk, and it's collected in a nice bottle, which keeps it clean. And then if the mare kicks at you, you don't dump all the milk out on the floor. It's a really nice handy contraption. In the lower photo, there's an automatic easy mare milker that almost works like a milk machine for a cow. There's a alternate suction that's provided into each component that goes on each of the teats, and so that's really nice as well. You can invert a syringe, like a 35cc syringe, using the finished edge next to the mare's teat, and again you invert the syringe, and so you can get a suction going in a syringe. That's a very crude way of trying to milk a mare. It's how I learned in school before the Utterly Easy Mare Milker came out. I don't recommend that. Anything you can do to try and get milk in a way that will keep the milk clean, keep it from getting spilled, and most importantly, keep the mare from getting mastitis is important. In the next part of the lecture, we'll talk about how to feed a foal to prevent developmental orthopedic disease. First thing we need to remember is what causes developmental orthopedic disease. It's multifactorial in many cases. In some cases, we don't know what the inciting cause is. It may be idiopathic with genetic predisposition. There can be in utero nutrition problems, which we discussed when we were just reviewing how to feed the pregnant mare. There can be in utero positioning issues, and there can also be trauma. Sometimes foals will get stepped on accidentally by a mare. Acquired causes of DOD usually are more common, with excessive energy leading to rapid growth being the most common reason. But there can also be improper concentrations of essential nutrients in a foal's ration. Minerals like calcium and phosphorus, as well as trace minerals and vitamins, can all cause developmental orthopedic problems. Soluble carbohydrates have been reviewed as well to see if excess sugars and starches could be causative issues for developmental orthopedic disease. That is an area of active research currently, and one where we hopefully will get a few more answers in the years to come. One important point to remember is that proper foal nutrition begins in utero, and you always want to make sure that the pregnant mare is being fed a balanced diet of energy, proteins, vitamins, and minerals. Nutritional causes of DOD, by far and away, excessive dietary energy is going to be your most common cause. That can cause a change. There can be a change in glucose and insulin regulation. One of the main things that can happen is a foal can gain weight before the weight can be properly supported on the cuboidal bones, especially in the carpus and the tarsus. It can occur if the foal is nursing from a mare that's a heavy milk producer. We talked about that earlier. Sometimes mares, usually multiparous mares, will produce so much milk that it will be more than a foal really requires from an energy standpoint, and so they will grow excessively fast. But excess energy intake can also occur if an owner supplements the foal's ration to promote rapid weight gain. In some cases, a foal may be destined for sale, it may be destined for a show, and getting a large, heavily muscled foal can be a goal from an owner and management standpoint. But rapid growth isn't always good for the musculoskeletal system of a foal, and sometimes it can be a very, very severe problem that develops. Dietary mineral imbalances also can be an issue that really depends on the type of ration that the foal is consuming. We'll go over that in a moment. Other specific nutritional causes of DOD include free feeding of forage and high energy feeds. Anytime a foal has erratic weight gain and sporadic growth, you can see problems with developmental orthopedic disease, and that's one of the reasons why it's a very good idea to have a client record the weight and the height of the foal on monthly intervals. That way, if a foal is growing too quickly and varies significantly from its growth curve, then an intervention can be done when the foal is fairly young and hopefully resolve any nutrition problems before they become skeletal problems in the foal. Compensatory growth is another issue that you can see in some foals. Compensatory growth is catch-up growth following a period of illness or protein-calorie malnutrition. The body of a foal, as well as other young ruminants, is designed to be a certain size at a certain age. So let's say, for instance, a foal gets rhodococcus equine pneumonia at 1 or 2 months of age, and that foal has stunted growth because it hasn't been consuming enough calories to meet its growth requirements. Maybe it's trying to fight an infection instead, but maybe by the time the foal is 5 or 6 months of age, the infection has resolved and now the body is ready to grow. And so if that 5-month or 6-month-old foal is given all the food that it can consume, the body will grow at a very rapid pace. There'll be a huge growth spurt in order to get the foal's body to be what it should be at that 5 to 6 months of age period, even though it may be very small to start out. So this compensatory growth, this catch-up growth, can be a real problem. And so if you're dealing with a foal that maybe has been sick in its early life, you need to restrict its calories a little bit. You don't want to restrict protein and other nutrients, but you do want to make sure that they're not getting too many calories. You don't feed for age, you really feed more for body weight, and you want to make sure you regulate that growth closely. You want the foal to grow, you just don't want them to grow too quickly. Excessive dietary protein alone does not seem to be a causative factor in DOD based on some research that's been done previously. And so your goal with a young growing foal is to have regulated weight gain and growth, and have the owner use charts to monitor that they can review with you. The nutrition of the mare during pregnancy can be important. There's some metabolic programming that goes on with the foal. One study found that foals that were born to obese mares compared to normal mares had higher serum amyloid A until 6 months of age. They had increased insulin resistance, and they were significantly more affected by OCD by 12 months of age than foals born to normal mares, or mares of normal body weight and body condition score. As I mentioned earlier, the issue of carbohydrate nutrition in foals is currently being reviewed, but even the findings of this one study that I just mentioned leads to the possibility that in utero nutrition is not only important for the mare but for the foal as well, and that obesity in a mare can adversely influence foals. So another really good reason to try and ensure that mares that are pregnant are fed appropriately, that they have an appropriate body weight and body condition score to help promote health of the foal. Again, goal, regulated weight gain and growth using charts to monitor. Monitoring foal growth with foals raised on a mare, you want to monitor their body weight using a weight tape. I think I mentioned earlier that weight tapes are validated down to about 3 months of age. At least the one that's used by Purina Mills and the one that they hand out is validated. They validated it with their foal herd. And so 3 months of age is when the value should be fairly close to what you'd find on a scale. I like to use the growth information from the NRC and look at the foal weights by month, and you can determine what they are by putting in an estimated adult body size of the foal when it gets to be an adult, and then you can just go down month by month, and the estimated appropriate weight of the foal will be provided in the online balancing program. And that way you can develop a chart that the owner can then use to plot the actual weight of their foal on that graph, and either increases or decreases can be noted fairly easily. Monitoring the foal's height using a weight tape is also important, and then as mentioned many times, wean the foal early if the foal is growing too quickly. Anytime you have an orphan foal, you want to feed to ensure adequate growth, again both based on these growth curves. Some high-quality milk replacers will cause fairly rapid growth. I've had foals consuming milk replacers at 20% of their body weight that have had to have a lower volume of milk fed because they were growing too quickly. And again, if you are monitoring weight, and that's so important to monitor it, because if a foal is growing too quickly, you want to catch that within 1 or 2 months. You don't want that foal to grow excessively fast for a number of months, because that way they're going to get older, they're going to weigh more, and it's going to be harder to get them back on that growth curve. And eventually they're going to get to the point where you're not going to be able to correct musculoskeletal problems if they are too old, too heavy, and they already have limb abnormalities. Offering creep feed by 2 to 3 months of age, as mentioned earlier, helps to improve the transition during the weaning period and can decrease stress, and that's good for the foal overall. Now, thinking about energy, you want to offer high quality, highly digestible forage to your young growing foals. You want to provide a consistent volume of feed in a regular manner. By 2 months of age, a creep feed can be offered for sure. I mentioned early as 1 month of age, but definitely by 2 months of age, a foal should be consuming a creep feed. And that's just a supplemental feed or grain, because grain is digested better than forage. And the guideline that I use is up to a half a pound per day per month of age. So a 2-month-old foal could be fed a pound of grain or an appropriate foal feed each day. You want to monitor the foal's energy intake to make sure the supplemental feed is not promoting too rapid growth. And then there are a variety of different foal feeds from different manufacturers. You can select different feeds based on carbohydrate content or fat content, and one particular product may stand out as better for a case versus another. So although there are a lot of different foal feeds out there, some of the distinguishing factors may be non-structural carbohydrate content. Looking at protein, foals should consume feed overall that has 14 to 20% high quality protein. This is usually what you're going to find with some kind of a commercial feed that will then be added to forage. You want to ensure adequate lysine and threonine in the ration. And if, as mentioned earlier, if a client is feeding high quality alfalfa hay, you want to ensure that the diet contains a proper balance of both calcium and phosphorus. Sometimes you can get into a phosphorus deficiency if you're feeding all alfalfa hay. And alfalfa hay alone has an improper calcium to phosphorus ratio. It can be up as high as 5 to 1. That may be okay for an adult horse, but for a young growing foal that's developing its skeletal system, that ratio of really high calcium to fairly low phosphorus is not ideal and can cause health problems. Fat, if you have to provide some energy in a way that doesn't include carbohydrates, you can use fat. I've only used that in therapeutic rations in very, very sparingly. It can be useful if you have to add fat for some reason to think about the omega-3 content of the oil that you're choosing. Again, I wouldn't recommend that in general. I have used that from a therapeutic standpoint, making developmental orthopedic disease rations, but then I'm also controlling for calorie intake very closely, and that also includes having a forage analysis done so you know exactly the nutrient profile of the ration that the foal will be consuming. Vitamins should be provided, but not in excessive concentrations. Focusing on minerals here, calcium and phosphorus imbalances can lead to problems. They both need to be in the diet in adequate amounts. You can't have an deficiency of either calcium or phosphorus because a deficiency of one or the other can cause skeletal problems. Excess dietary phosphorus will bind calcium and limit its absorption, so you actually don't want excess phosphorus either. Some clients I've seen add wheat bran to a foal's ration. Wheat bran is very high in phosphorus, and that would be a contraindication for the ration of a young foal unless there was some reason why it was added in a very balanced way. The calcium to phosphorus ratio I mentioned earlier, but it's a secondary importance compared to the actual amounts of calcium phosphorus in the ration. So if both calcium and phosphorus are adequate, then the ratio can range from somewhere between 2.5 to 1 to 3 to 1. But you certainly don't want it as high as 5 to 1 like you would get if the foal was only consuming alfalfa hay. Cereal grains tend to be high in phosphorus as well as high in phytate and high in energy, and so you want to be sparing when you add cereal grains to the ration. As I mentioned, wheat bran specifically is high in phosphorus and probably isn't ideal to use in a full ration. Some hays may have an inverted ratio of calcium to phosphorus. If you're ever unsure of the calcium and phosphorus content of a foal's ration, have the forage analyzed. Whether it's hay or whether it's pasture or both, having an analysis will give you the information you need. And especially for young growing foals, it's a little bit risky to try and assume that you know the nutrient composition as well as the digestibility, protein, energy content of a forage. An analysis is close to about $30, and it's a very wise way for a client to spend their money to ensure adequate foal growth and health. I've included the recommended concentrations for growing horses of both calcium and phosphorus. This can be found in the NRC guideline as well. Now moving on to trace minerals, copper was mentioned earlier when we were discussing the needs of pregnant mares. But the copper concentration in the diet of the dam may be more important even than the copper concentration in the foal's ration. And in the study that was mentioned previously, mares that were supplemented with copper when they were pregnant compared to mares that were not supplemented, the foals when they were born had liver copper concentrations measured, and then the foals that had the lower copper concentrations at birth were less able to repair OCD lesions between 5 to 11 months of age compared to the foals that had adequate or had higher liver copper concentrations. So good health for the foal begins in utero. You always want to make sure that the mare is getting an adequate ration. And then finally, you want to ensure adequacy of other trace minerals. Organic chelated minerals do not seem to have a significantly better bioavailability in young growing foals compared to inorganic chelated minerals. A lot of feed companies will make a sales point of mentioning that they are using organic chelates for their minerals, but the research that's been done to date hasn't really shown that the bioavailability is that much better. Is it a problem to feed it? Absolutely not. And most foal feeds will have some kind of organic chelate in them for many of the minerals that are available. But just from practical standpoint, many inorganic minerals have good bioavailability in horses and foals as well. We'll end the lecture with a couple slides talking about managing a foal if they have developed orthopedic problems. These cases can be very challenging. It's ideal to try and determine the cause if that's at all possible. And here I've divided the foals into two groups. The non-nutritional cases, you may not be able to significantly change the outcome with the ration. Maybe there's some genetic predisposition, maybe there's been some trauma. Hard to know exactly why sometimes these cases present. You may not have a good history on them. If you do have a history and a diet history, and you can fairly easily determine that the foal has consumed too many calories at too young of an age and has grown too quickly, even with those foals, the outcome is questionable. It really depends on the severity of lesions and the age of the foal. The photo here is of a standard bred at about 9 or 10 months of age. It initially presented at 6 months of age to the veterinary hospital, and it was knuckling over on both hind fetlocks, I think, as well as the front 4 fetlocks. It had stripping and plating done on I think most limbs. This was a horse that, as a foal, the owner wanted to be not only a standard bred racehorse but a breeding stallion, and the owner was very determined and forceful about saying that they wanted the foal fixed with the ration. Even if your owner is pushing you for an answer and for a solution, don't ever be overly optimistic with your prognosis. The older the foal is by the time they present, the less likely you are to make changes, even if it is a nutritional cause. If you get a foal at 9 or 10 months of age that already has a lot of limb changes and has already been growing too quickly for many months, you're not going to be able to reverse the changes that have happened. You may be able to help prevent future additional problems, but even that is fairly questionable. That goes back to one of the ideas of the younger you can get a foal, if they are starting to develop limb abnormalities, the better chance you have of trying to resolve that with nutrition and or orthopedic management. So how do you manage these foals? It's really important to get a complete diet history from the owner. You want to know not only what they're eating at this point, but what they were eating previously. In some cases, you may have had a foal that has been evaluated from a veterinary standpoint that has been on a severely calorie-restricted diet. There are still there's still a philosophy that circulates that a foal that has crooked limbs, you just have to restrict the energy and really cut them down on the volume of the hay they're getting, or put them on a poor quality hay. But when you do that, the problem is you're not only restricting energy, but you're restricting all other nutrients. And so you really want to make sure that it's one thing to reduce calories, but what you don't want to do is stunt the growth by restricting protein and vitamins and minerals as well. So getting back to the diet history, not only the type of feed, but the feed volume is very important. Hay or pasture analysis in these kinds of cases is essential. There aren't many cases that I deal with from a consultation standpoint and a ration formulation standpoint where I will require an analysis. But with a foal, if you're trying to manage developmental orthopedic disease, you absolutely need to know not only the mineral concentration, but the digestibility of the forage, the calorie content, as well as the protein content. You can use the NRC tables that I've mentioned previously to evaluate the foal's body weight. You can make a growth curve and plot the foal's current weight based on its age, see how close or how far it is from its growth curve. And if you want to slow down growth, you can restrict energy a little bit. You don't want to restrict it too much. You don't want to stunt the growth, because then you're going to get into that cycle of compensatory growth if you stunt the foal's growth too much and then provide it with more feed and calories later. But you want to slow the growth but not restrict other essential nutrients. These kinds of cases, unless you're really familiar with working with them, it's probably a good idea to involve a nutritionist in the management. They can be fairly challenging to do. So working with these cases, you have a forage analysis, you design a ration, you restrict energy if necessary, but you want to make sure there's adequate protein and lysine in the ration, as well as adequate vitamins and minerals. You also want to look at the calcium to phosphorus ratio and the actual content of both of these minerals to make sure that neither one is deficient. You want to communicate the growth goals to the owner. You want the owner to continue to monitor the foal's weight and height, especially if the foal is being managed in a farm situation. Most people don't have a scale, so you're going to have to rely on a weight tape. It may not be ideal, and if you have a really severe case that you're aggressively managing, then if the foal can be trailered fairly easily, having the foal come into a clinic or a place where it can be weighed may be an important part of your management. But keeping a diary of what is fed and what is consumed can be important, and digital photos are always important as well. Remember, even if you're restricting growth, as the foal grows, it will require a change in its nutrient composition of its ration. So let's say you have a 6-month-old foal and you're managing it. You can't feed it like a 6-month-old foal when it's 9 months of age. So another issue with these cases is that every month you need to review the ration and adjust it based on how well the foal is growing. Have they gained too much weight? Are they gaining an appropriate weight? Have they lost body condition score? Maybe they weren't getting enough protein and so their muscle mass has decreased. The adjustment of these rations has to be done frequently, usually every month or at a minimum every 2 months. I prefer to make the changes every month and then continue to communicate with the owner to make sure that everybody is on board with the program, that the foal is growing at an appropriate rate. And again, you can't guarantee that once you change the ration that the foal will resolve. If it does have some abnormalities, maybe you can make some adjustments so they don't worsen, but being realistic with the prognosis, circling back around to that idea is going to be very important. This was a case, I don't unfortunately have an earlier picture, but this foal actually had some developmental orthopedic disease and resolved and ended up being a fairly nice looking yearling. All right, are there any questions? If there are, please send me an email or we can bring them up in a discussion. We will be having case 1 is the orphan foal case, and that would be an appropriate time to bring up your questions, or you can add them to a discussion chat online, or feel free to email me with any questions that you may have.